I'm Dr. Rajani, and today I'm reacting to a story on a UK TV magazine morning show about Anastasia. Many of you know her. She's become very popular for her cheek fillers and her lip fillers, and we know that's the #1 driver to clinics, especially the lip filler. And Dr. Stephen Harris is going to be involved in this morning show and comment, and they're going to talk back and forth. Let's dive right into this one. Extremely fascinating, extremely pertinent. Let's hear what they have to say.
The doctor is there alongside a lady called Anastasia. And Anastasia joins us from Kiev in Ukraine there, and she says she has spent thousands on what you believe, Anastasia, is perfecting your look. And what I want to show people, Anastasia, is just a few years ago, just a couple of pictures of you before you embarked on these treatments. This is what Anastasia used to look like, and she now obviously looks like this.
Okay, so this is fascinating, and I want to know in the comments before, which do you like better, her before or her after? Obviously, there's a dramatic difference, and obviously, she's much more popular with the cheeks, with the lip filler. She wouldn't be on this morning show, and she's been on a few times, and her Instagram wouldn't have exploded as it did if she didn't have those cheeks and lips. Let's keep listening, see what we can learn.
Right. So obviously the before treatment is on the left-hand side each time, and the after treatment is on the right-hand side.
So she looked very pretty. She had great lip volume before, beautiful nose, beautiful features, but look at those lips. Lips are a driver to practices, definitely, and they are definitely picked up by our social media algorithms, and people get a lot of attention for lips.
So Anastasia, how do you think your treatments are going? You're only 32 years of age. How do you think they're going?
I'm sorry, can you please repeat the question?
Yeah, how do you're happy with what is happening to your face?
Yes, I'm very happy. I'm looking for my pictures for a few years.
So she says she's really happy, and that brings up a point, and I ask it often in my community section, and I take polls on what you guys think. Very fascinating. Check out the community section. But the point is, she's happy with it. Who else needs to be happy? And that's a great point that she brings up. She's doing it for her. She also said something interesting. She can change it. That means it's hyaluronic acid fillers. Those are the only ones you can reverse. I like Bellafill, I like Radius. You cannot reverse those. Things like bioalchemid, silicone, they can't be reversed. They're associated with more problems. So she's using hyaluronic acid filler. That's a benefit.
So what was wrong? I'm just looking at that. I'm just saying, what was wrong with this lady on the left, who you were?
I don't like my face because you see, I look like a hamster. My cheeks is here, and I love slim face.
So you like to look like a hamster.
Now, do you see this? The announcer, she said, I like slim face. We know in the aesthetic industry, beauty is math, math is beauty. We know what she's talking about is the higher cheek often gives the slimming effect. Because she's overdone, he's thinking she looks like a hamster now with the mouth full. So they miscommunicated, and you can see the difference. Obviously, he's not in the aesthetic world, but any aesthetic provider knows adding volume to the top in moderation does that.
No, I think that I was like a hamster because my cheeks was here, and I love this line, you see?
You wanted them higher up, more defined. So tell us, Anastasia.
And look at her. The female announcer, she got it spot on. She knew exactly because she puts makeup on. She's on TV. She knows about contouring.
Tell us what it exactly is you've done to your face, the procedures you've had, Botox, fillers. What have you had done?
Of course I have Botox because I'm 32, I need Botox, I have wrinkles, yes. I have fillers in my cheeks. I have fillers in my lips. I have fillers here in these jaw angles, yeah. And my chin.
Notice that. Fillers in the cheeks. What are we seeing? New FDA approvals, cheek fillers. What did she say? Lip fillers, new fillers coming for lips. She said jawline and chin. The most recent, chin fillers, FDA approved. There's no wonder what's coming down the pike and the direction of the industry. This is it. Not meaning to this level, but she indicates what the companies know.
Do you look at anybody, we talked about various celebrities there who talked about treatments they've had. Has there been somebody in the public eye maybe that's been an inspiration to you? Is there a certain way or person you wanted to look like?
No one. I want to look like I am, but like nobody else, no.
Now,
I
Doctor,
can say that this woman is beautiful, this person is also beautiful, but I never was inspired by somebody, never.
Now, I told you she's super sweet. This tells you that she's doing it for herself, or at least that's what she's expressing. And that's important to aesthetic providers. When people come in and want to look like someone else, that sets off an alarm with us.
okay, you are you. Okay. Doctor, the reason we're talking about all of this is that you have recently, you're a bit worried about this, and you say that there is a danger that people turn into what you term a twisted version of modern beauty that encourages people to adopt alien-like features, you're saying. Is this an increasing trend?
So let me first clarify what I mean by alien-like features. I'm talking about what we refer to as distortions, whether it be mistreatment or overtreatment, beyond what we would consider the normal range for the individual. So not.
Okay, very interesting. Dr. Stephen Harris, a well-known doctor in the UK, well known for his holistic approach. Notice his choice of word, distortion. I like that. I think there is a distortion we get of our natural anatomy. But outside of the normal limits, so that we can't put our finger on that. What is the normal limits? What's the normal limit for me, for you? How can we put that upon someone else? But his point is very well taken in that we know the math of beauty, and math doesn't make beauty, but it's a component that as an aesthetic injector we're meant to know. But distortion, very astute comment, because especially when we talk about lip filler, in a defined space, we know we get migration. We know these fillers last 10 plus years on MRI studies. I've injected for over 20 years. I have patients over 20 years. As long as 10 to 15 years out, I've had to dissolve fillers. So we know they last long. There's an issue there. But where is that line? And that's where we're always, I guess, discussing and bantering about.
Like some alien from outer space, but for the individual specifically.
Yeah, and do you think Anastasia has been overtreated?
In my opinion, she looks to be overtreated. She clearly doesn't feel the same. But looking at her objectively, from a professional point of view, she does appear to be overtreated, and I would also ask if you feel the same. So I think we have a built-in mechanism, and we become immediately aware when someone is overtreated.
But I suppose that's a matter of opinion, isn't it, Dr. Harris?
So the female announcer picks that up right away. It's a matter of opinion, and that's the line I'm talking about.
Because you have your, you have your own clinic. I understand the clinic is the largest user of Botox and fillers in the UK. So you are carrying out these procedures. So at what point does it become too much?
Just a correction, I'm the largest single user. I mean, there are much bigger clinics than mine.
Very important. So I don't know, I'm surmising, but this is why someone, at least in America, would stop there and say, I'm not the largest clinic, I'm the largest single user. Now she's trying to hit him back and say, well, you're the cause of this problem. You're one of the largest providers in the UK. There's two things there. One is, just because he's a large provider doesn't mean he's doing that much on one face. The other thing is, if he was misrepresented himself as the largest provider in the UK, that is a badge of honor to clinics. and it's crazy to me, but clinics would be like, well, I'm the #1 provider of XYZ in the Northwest region or the Southwest or the world, whatever it is. And the companies promote that. So in 2005, I was the top level that you could get with Allergan for they did Botox at the time, and Medicis did Restylane. That's what we had in this country, 2005 to 2007. They're going to treat me very well back then. I was a 30-year-old kid, so I didn't know really how to take advantage or what that even meant. But when you start coming down on the tiers, they'll say, oh, you dropped from platinum to silver. What happened to your practice? Why are you failing? Companies want to sell product, and those tiers of levels are very motivating. So the clinics around him would be quite upset at saying, hey, you're not the biggest, you're misrepresenting. Likewise, when you're the top level, they'll say, Dr. Ajani's a top level account. What he does is XYZ with his patients. You might want to adopt his practices so you get to that level. It's a competitive thing. And as we get older in our practice, that's all background noise, but very interesting.
It becomes too much when the look becomes exaggerated or outside normal for that individual. And we have to understand that there are inherent risks with overfilling, both to the physical and psychological well-being of the patient. And so these are things we need to consider and need to be taken into account. And as I said, most of us can see or can tell when someone appears exaggerated or distorted. And so the risks are what we need to consider.
Yeah. Now, Anastasia says she is happy. She's very pleased with the way she looks. Do you think, or what sort of responsibility goes with being a doctor? You say you can see when things have gone too far. What responsibility lies with a doctor to point that out?
Understand here, in my clinic, when I recommend people to do resurfacing, radiofrequency microneedling, fractionated RF, chemical peels, things that are going to give them glow, build some collagen, but not create angles and folds, there is resistance. And they don't want to spend the money on it, because when you make contours, when you make lines, when you make big lips, when you make someone look dramatic, they can take that selfie at night and be a rock star and get all kinds of positive comments and likes on their YouTube, on their other social media channels. And if you just get the treatments that make people look natural, they're not getting the feedback from the world or placed on the algorithms so that they're being shown, or getting TV interviews. You have to, if you're going to move up in the ranks today, and moving up in those ranks means earning more. It's a direct correlation. Then the more you do, and to his point, the distorted look is rewarded.
Well, our first duty of care is to do no harm. And if we are exaggerating or distorting features, then we're not fulfilling that. And so this is what we need to look at very carefully. And there has to be a process of education involved, both to my colleagues and also with our patients. In other words, they need to be made aware of the risks that I mentioned.
And Anastasia, has a doctor or practitioner ever said to you, that's too much now, you need to stop, that's enough? Would you listen if anybody told you to stop?
She has admitted in prior interviews she injects herself. So that is an issue that we don't have regulators when we're injecting ourselves.
By the way, I'm a psychologist by graduate, if you don't know. Nobody told me that, because all people with whom I work or talk, about my appearance, they know me well. And they know that I'm a normal person, yet. I'm not crazy, not stupid,
So she's educated. She is a psychologist by graduate. And when you watch the interview, she's consistent in her message, which of course I like.
So I understand that this is extraordinary, yes? This is really extraordinary, but it's normal and it's good for me. I'm happy with this look.
So in a way, you agree with the
Of course, I
doctor.
will never listen to somebody.
In a way, you agree with the doctor because you've described yourself as a beautiful monster.
Yeah.
You got to hit. So if you're on TV, you got to create drama. A beautiful monster. I mean, it's her own words. Let's see what she says.
Yes, the prettiest monster you have ever seen, no?
She's got a good spirit. You have to give her that.
I mean, Dr. Harris, Anastasia seems very confident. She said, you know, she's graduated as a psychology degree. She seems very happy with her look. But your concern is often for younger people who you believe are being influenced, particularly with social media, with some of these extreme looks.
Yes.
Sorry.
So that's essentially the end of the interview. Very fascinating stuff. I put a lot of these questions on the community in the poll section. I learn a lot from you. I want to hear your comments below. I put a complete playlist up here, things you can do at home to avoid having to get injections and procedures done at your clinic. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.